Every year, National Epilepsy Week is celebrated to raise awareness about the condition. Epilepsy is described as the tendency to have recurrent and unprovoked seizures, which are caused by a temporary change in the brain cells' work. And most of the time, people with epilepsy hide their condition because of the stigma and discrimination associated with the condition. Now, to talk more about the condition with us, we are now joined in studio by Magdaleen Kruger, who is Epilepsy South Africa Director in South Africa, in Gauteng, the region there. Welcome to AM News, Magdaleen.
Thank you.
Now, what is epilepsy? Can you kindly just describe it for us and just tell us how is it prevalent in South Africa?
Epilepsy, the word comes from an ancient Greek term, a verb called to seize. Epilepsy, in short, is an electrical discharge on the brain, and that causes the seizures. 1% of our total population has epilepsy and live with the condition daily.
And, you know, before we actually had our interview just now, you informed me that we do not refer to people suffering from epilepsy as epilepsy sufferers. And those are some of the myths that, of course, are in the country.
Yes.
But can you share some and more, perhaps, myths, stigmas, discriminations that are associated with epilepsy?
In our country, people believe you bewitched, or the forefathers are punishing you. Those are, and that it's contagious. And that people with epilepsy can't marry, that they can't live a normal life. Those are all myths. And a person with epilepsy can do anything you and I can do. If you knew someone, or you didn't know someone had epilepsy, you wouldn't treat the person differently from me. Yeah. But when you know it, you suddenly act differently, and those are the discrimination we try to erase with National Epilepsy Week.
Now, who can then suffer from epilepsy? Is it a condition that you are perhaps born with? Is it inherent? Is it a condition that you can perhaps, incur during your life as you grow older?
Any person can have, up to 10% of the population can have a seizure in a lifetime. But as you said, it's a recurrent condition. Any person at any time of his life can develop epilepsy. In the developing country, it's mostly in later childhood and early adulthood. And then there's a slight increase in old age again.
And can it be cured, or can it be prevented?
It can be prevented by preventing illnesses from the brain, trauma to the brain like accidents. Cured, not yet, but 70 to 80% of people with epilepsy seizures can be controlled with anti-epileptic drugs.
All righty then. But moving on to the different types of epilepsy, if there are, and those perhaps some of the myths that you can even, sort of like tell us more about. But are there stages to epilepsy? Is epilepsy one kind of a condition? Are there different levels, different stages? Does it get severe at a certain point?
There are different kinds of epilepsy. Let's start with question number one. Yeah. There's one type that we call generalized seizures. So the seizures start saying your temporal lobe and spreads all over your brain. Or then there is specific areas, and it doesn't go generalized. So it starts in temporal lobe, it stays in temporal lobe. There's many different types of seizures. It's the one that's mostly known as epilepsy, where a person will drop down and kick and shake, and that's called tonic-clonic. But epilepsy can as light as doing this. Or,
blinking your eyes.
Yeah, that can be as light as that. So stages of epilepsy, some people do get an aura, a feeling that tells them a seizure is coming on, and then can prevent the seizure if they go sit down or relax or stop doing whatever they were doing and just rest.
Now, you mentioned the condition of epilepsy where someone will drop and kick. I know that in some cases they will bite their tongue or foam in their mouth. What can one do when they witness someone having an epileptic seizure?
Yeah, turn the person on his side in the fetus position, recovery position we call it. And if you're on the side, bend the person's head backwards so the airway stays open. And then if there is saliva or so, just clean it away, cushion the person's head so he or she doesn't hurt their head, move things in the way away, and loosen tight clothes. And just stay with the person until the seizure is over. There's nothing you can do to stop the seizure. The seizure must run its course. And then stay with the person because they won't know where they are, what happened. So just reassure them, tell them you had a seizure, are you okay? Do you know where you are? And so forth. It's nothing, don't go with the spoon near their mouth because you will only harm their teeth and mouth.
You know, I'm getting a sense that it's important for the person who is actually suffering from epilepsy to be aware of this information, but also the family members and the friends to also be aware.
Yes, it's the person with epilepsy has the duty to educate people around them. Epilepsy South Africa will also go out to schools to educate teachers and learners about the condition, or to workplaces. We've been to workplaces to tell, don't call an ambulance, not if the seizure is less than 6 minutes, and normally it is.
Okay. And speaking about being aware and having information, can you kind of give us your information and where perhaps we can call or contact just for more information if people need help?
Yeah, they can call us on a weekday, obviously. I'm going to give my office number, 011-816-2040. And we have a website, www.epilepsy.org.za.
Alrighty then, Magdaleen Kruger, Epilepsy South Africa Director in Gauteng. Thank you so much for joining us and informing us about the Epilepsy National Week.
Thank you so much for the opportunity.
Thank you, Magdaleen. Alrighty then, that's the information that you have there. Make sure that you do go to the website, make that you do call in if you know of a friend or a family member that is, of course, suffering from epilepsy, and you want to know more about the condition. Make sure that you acquaint yourself with the necessary websites and contact details.